Hey everyone. Alright, I am doing this video to show you guys what my day kind of looks like. Does not feel center in my head. As a dental hygienist. Now, I could do like a specific like morning routine video, but honestly, I don't do anything special. I just wake up, sometimes barely on time. I shower and I do my hair and makeup just because it makes me feel better, even though I know half of my makeup is gonna come right off on my mask, but that's okay. It's kind of like what helps me set the day or set the tone for the day, right? Because if I feel crappy in the morning, my whole day will be crap. I've always known that that's kind of what made me feel better during the day, but when you have no money and you're sparingly using your makeup so you don't waste it, and you're cutting your own hair because of COVID and to save money, I have been for the past few years. Yeah, I just haven't, or I wasn't feeling my best. So obviously I'm working on that. Anyway, I want to show you a day in the life of a dental hygienist. I'm doing it today because it's just a hygiene day. It's just me and the front desk that are here, so I feel a little bit better about showing you guys some stuff. My day starts off after getting ready, coming here. I got Starbucks for the first time this month and it's almost halfway through. Well, okay, the first time I paid for it. I've been trying to lay off the coffee and stuff like that. I'm gonna show you guys what my op kind of looks like if I can show it at a certain angle. The way my op is set up, it's quite clear like what my office is, and I don't want to give up my office name, so I can have to do it at like weird angles. All right, it's just me today, so I'm doing all the sterilization, everything myself, so that takes a bit of time. The last time I was here, I set up all the trays for myself, so that's all ready to go. My first patient of the day, I'm just doing a scan for a night guard, and I don't do those very often, so I'm pretty slow at it, and they only gave me half an hour for it, which is fine, which is I think more than enough for people who regularly do the scan and they know what they're doing, but this takes me freaking forever. I'm gonna go in and start setting up. So I have my patient charts here. I turn on my light, turn on my computer. There's the button there. I'm trying not to show anything. My trays here. I have more in the back that I need to grab, and then I just have everything prepared to go. First patient doesn't need that, so just doing a scan, and then I set this all up. I'm gonna go do that right now. Alright, so I'm done for the day. I'm just getting this ready for the, it's called back attack, for the suction system cleaner. I do that every shift at the end. And then I have just been dumping all my instruments. I have to sort them out now. I had enough trays for all my patients today, so I didn't bother putting them on trays yet. I'm the only one here now. I'm just gonna do the suctions, finish my notes, and then I'm gonna do the trays. Ultrasonic tips in a separate container so that they're not contaminated if I put them on every tray. I just kind of pick them up as I go, and it kind of keeps them more protected too. So I just group them together along the polishing cups. I put them on the tray. Normally I don't, I just put the purple tips and then we put them in the container where anyone can grab them, because I'm not the only one that polishes. But my next day here, I am again the only hygienist. So I don't feel bad about taking all the slow speeds, but normally it's not usually in this big of a pile. I'm a lot more careful. Usually I have a order of instruments that I put, but because it's just me and it doesn't really matter, I don't need to do it this time. But I essentially put the dentist's instruments when he does exams off to the side so that he's not searching through my trays. So that's a tip if your dentist's, when they come in for exam and they like certain instruments to use, just keep them together on the tray so that they're not wasting time at looking for it or asking you to look for it. So he likes an explorer and a mirror. It looks something like this. And then I put it on their shelves in the cabinet. Alright, so just gonna tell my sister I am filming something quickly for the last little part of this video. Filmed like an ending before, but of course I don't like it, so I'm just gonna be re-recording what I said. So my parents are coming home soon. I'm in the kitchen just trying to get this over with. Okay, so this past week has been kind of crazy. Like you saw, I recorded a video of day in the life-ish, kind of, just more like kind of like what I do at work. But yeah, I just want to kind of end off the video roughly how my day kind of looks. Just a lot more hectic, a lot more running around, and I get a lot more help with sterilization. I haven't brushed my hair in a few days, so sorry about that. And of course, you know, if you aren't yet at that point where you're working full-time or at a school, just keep in mind that every office is different and everything is done differently. I am following the protocol of the hygienist before me. That's kind of what was taught to me. That's how they do it at that office, sterilization. I'm still struggling with feeling like a fake imposter, but every time I get one of these days where I'm just working by myself, I don't have the distraction or the dentist kind of, the thought of the dentist having to check my work or come do an exam over my head, I get better at it, like, because I'm just left it alone. I don't have to worry about timing as much. I do to an extent, but I notice that every time I have these days where I'm just in the office by myself, I am less stressed out and I'm just able to kind of really improve on things. Like something that I noticed that I didn't do well in the last patient, I'll try and fix it on the next. So yeah, if you guys ever get a chance to just do hygiene days at an office where there's no dentist, it's just you, maybe other people in the office, but they leave you alone, go for it, because it is so calming and relaxing and so enjoyable just scaling away. Near the end of that day, I was starting to get like random pain in my lower back area, and I took myself to the ER that night with the assumption, and it was the right assumption, that I had a kidney infection, and I did. So that whole day was, if you see me kind of look weird or squint or like grimace, it's because I had a kidney infection and it was starting to get super, super painful. Yeah, when you're a hygienist and the only one, and you know, you kind of have to work through it. Luckily, it was only starting to get worse near the end of the day, and I'm glad that I went straight to the hospital, to the ER, to get that checked out. The doctor was quite shocked that I knew exactly what it was. I also was able to look at my blood test results before they even looked at it themselves. Because of the way that it is in BC here, I have access to my blood test results, and so I was looking at them showing pending, 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 and then as they popped up, I was able to read my results before the doctor was even able to get to them. Let me know if you guys want a more detailed video. I mean, this is pretty detailed, but I did write out a Google Doc for my friend, like step by step, like what I do, and kind of branch out. So like if a situation were to happen like this is what I would do. Again, this would all be kind of catered to my op. The way that my office works, kind of thing. But if you want, I can kind of do a sit down video where I go through that document and explain everything, all the stuff that I learned. And then if you guys have any tips or tricks for me, you're more than welcome to comment in that video. But let me know if that's something you're interested in, because it is kind of similar. It is kind of similar to this video. It's just that in that video I was kind of going to go in a little bit more detailed of what I would do next if something popped up, and all the little tips and tricks that I learned pertaining to like that one thing. For example, like how to get water to stop dripping down your hand when you're using the ultrasonic, that kind of thing. Again, I'm no expert. It's just what I've learned in the past 3 months of working as a full-time dental hygienist. Anyway, you guys, I'm gonna leave that there. I'm gonna go do some more grocery stuff. Thanks for sticking around. I really appreciate every one of you guys and all your comments. They really mean a lot to me. Thank you again. I'll see you guys in the next video. Bye.